Psoriasis is a chronic inflammatory condition that causes patches of thick red skin. Although generally not life-threatening, it can be associated with substantial debility and poor health outcomes. And to make matters worse, about 30% of these patients subsequently develop psoriatic arthritis, a debilitating form of arthritis that can, at its worst, cause destruction of the affected joints, ultimately resulting in disability and significantly reduced quality of life for those afflicted. Why some patients develop psoriatic arthritis and others don't is currently unknown, but researchers believe it results from a complex interplay between genetic, immunologic, and environmental risk factors. For this reason, we have had great interest in identifying environmental risk factors, as these are one, potentially modifiable, and two, can be used to select for high-risk individuals for early screening and treatment to prevent or reduce disease severity. My research in particular focused on occupational environmental risk factors, as previous studies have suggested a possible link between mechanical stressors and the development of tissue microdamage that may precipitate the onset of arthritic disease. We hypothesized that individuals with physically demanding occupations harbored more severe disease activity. We obtained the job histories of 345 patients with psoriatic arthritis who have had the disease for at least 10 years. And then using a standardized job classification database, we calculated the total exposure to which they were involved in various mechanical activities, such as total time spent standing, time spent twisting the body, and exposure to whole body vibrations, and so on. We then performed statistical analysis to assess if any activities were associated with more severe joint damage, and the results were in accordance with our hypothesis. We found that an increased exposure to using hands to handle objects, using hands to make repetitive motions, prolonged time twisting and bending the body were associated with more severe peripheral joint damage, such as in the hands, wrists, and ankles. Similarly, we found that jobs requiring high manual dexterity, static strength, dynamic strength, and trunk strength were associated with more severe spine damage as seen on X-ray. So what does this new information allow us to do? Well, now that we know that particular job activities are associated with a higher risk of more severe disease activity, we can identify jobs that put psoriasis patients at higher risk for developing more severe joint damage, and these individuals can be screened or receive intervention early on to prevent or even halt disease progression, which for some can mean the difference between mobility and disability, and for all, a healthier, happier quality of life. Thank you.